All right, everyone, we're going to get started. Good afternoon, good morning, good evening. Welcome to our Innovations in Tobacco Control lecture series. I'm Joanna Cohn. I'm the director of the Institute for Global Tobacco Control. We've got a bunch of people online, and then we also get the lecture up on our YouTube channel after the fact. So if you have friends who aren't able to be here live, you can catch it later. So I am super thrilled to introduce our speaker for today's Innovation in Tobacco Control lecture, and that is Dr. Jeffrey Drope, a research professor right here in the Department of Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health. And he's also director of the Economics for Health Project, which is a research group that specializes in economics of public health. Now, before Dr. Drope came here, he was a research professor at the University of Illinois at Chicago. And prior to that, he spent 8 years at the American Cancer Society doing similar work. And he was, in his role before he left, he was scientific vice president at ACS. And he held a couple of academic positions prior to that as well. So Jeff focuses on the nexus of economic policy making, particularly taxation, with public health challenges such as tobacco, alcohol, nutrition, and physical activity. And his work focuses on, in addition to taxation, illicit trade of tobacco and alcohol, the economic costs of tobacco and alcohol use, and the science and regulation of tobacco products such as including e-cigarettes and the economics of tobacco farming. So a whole gamut of topics. And he's the author and editor of 3 books and more than 200 research articles, chapters, and reports on the political economy of non-communicable diseases. So he has tremendous expertise, and in addition to all the scientific work that he does, he also does very practical work, working with governments, providing technical assistance to be able to put all of the words into practice and trying to improve health and improve countries' prosperity through this work. So I am delighted to welcome Dr. Jeffrey Drope as our speaker to talk about making a stronger case for health taxes. So welcome, Jeff.
Thank you so much, Joanna, for a lovely introduction. And thank you to you and Kevin and the whole IGTC team for the invitation to share our work with you all today. And thank you all for coming. I realize you all got lunch, which may be a larger draw than me, but I'll take it. So it's a big win. And then I say thank you to all the people who are also joining us online today. It's really exciting to be here. Today, I am going to be making the case for health taxes, or as the previous slide said, how do we make a stronger case for health taxes? And I want to say that this is going to be a high-level talk. Our team, and I'll talk a little bit about what our team does so that if you're really interested in the fine technical details, I'll point you to where you can go and look at these things. But today I really want to talk about really some of the overarching things that drive our work and really drive the broader effort in public health to use health taxes as a tool to improve public health globally. And I'll talk about the success we've had and, quite frankly, some of the challenges that we've had and how I think we might be able to overcome some of those challenges over time. But first, I want to talk about our team and talk a little bit about the work that we do so that you can go look at it. Normally, when I give these types of talks, it's frankly usually about one of these areas that I'm going to discuss in a moment. So it's kind of fun to actually be able to take the bird's eye view and look down even on ourselves. This is our team. There is a really fantastic group of people that work on the Economics for Health team, scattered around the United States and even the world. And I want to make a plug here for team science. I really think that we work better as teams of scientists. I think that being able to share your ideas with other people, having other smart people to collaborate with, other smart people to challenge you on your logic. These are really great things that make you a better scientist. So I really want to put a huge plug in for just this broad idea. I get to go to work every day with really, really smart people, and that's amazing. And I think that the whole is much greater than just the sum of the parts, if you will. I will say that probably the smartest things I'll say here today, I've blatantly stolen from the smart people with whom I work. And then the not so smart things that I say cannot be attributable to them. So I may even point out 1 or 2 times when I'm just completely stealing from other people. I think if you cite it, that's all good. We work all over the world. We work in all regions on health taxes and related issues. And what we typically do in this idea of team science is we work actually with in-country collaborators in all of these countries that you see. I think I've missed a few, but I think I've got most of them here. Again, this idea that we work better as teams. We learn more, we understand local contexts better when we work with people. It helps us to build capacity. You know, in a lot of these places, smart people weren't working on health taxes. And then we showed up and said, hey, this is a really interesting and important area. You should work on it. And now they do. And they're really good at it, as good or better than we are. And that's tremendous. And that builds capacity. It builds sustainability for the science that undergirds this broader effort in public health. So I really, again, think this is very important, this type of transnational cooperation. So what do? We do a lot of, I would say, original and policy-specific and timely research in areas related to health taxes, but not limited to, I should say. You could see I've got a nice list here of sort of the main areas in which we work. We're mostly economists, so you can imagine some of the things we work on are pretty obvious. We look a lot at demand elasticities. We look at income elasticities. We do a ton of tax simulation modeling because we work with finance ministries around the world. As Joanna said, we do a lot of technical assistance work, and we do a lot of forecasting and some ex post analysis as well. And then we look at all the things all around health taxation. For example, distributional impacts, which is a fancy way of saying progressivity. We're really interested in how these affect people in terms of, are these progressive taxes? Do they help the poor? Do they hinder the poor? These are important questions to ask. We look at economic costs. Again, I'm going to have another shameless plug here for our work. We have another sister website that we work with Vital Strategies on called the Tobacco Atlas, tobaccoatlas.org, very difficult to remember. And on that website, we actually recently released a tool to estimate economic costs of tobacco, and then to also see how it relates to taxation specifically. And it's just a really tidy tool. And I will say, it's a very sophisticated methodology. We worked closely with the American Cancer Society on this and Vital Strategies, and we came up with a methodology that I think is very defensible, very transparent, and accurate, and frankly, cheap, right? Because instead of doing an economic cost study for every country in the world, which is very expensive when you're dealing with tobacco, alcohol, sugar-sweetened beverages, et cetera, we're building these tools so that these are defensible shortcuts because we obviously have a resource constraint always. We look at macroeconomic impacts of health taxes, effects on employment, economic growth. We look at supply and value chains. We use a variety of methodologies like input-output analysis, CG analysis, et cetera, to look at these things. As Joanna said, we work a lot in the area of illicit trade, both looking at how much illicit trade there is, but also trying to understand what is the nature of illicit trade, because there are very different types of illicit trade, and they have different types of policy remedies. And then we work with governments and other international governmental organizations to come up with strategies to actually mitigate this illicit trade, because illicit trade is bad, and it actually undermines our public health efforts, as well as the fiscal efforts of finance ministries. And then we work, as you might imagine, on initiation and cessation, particularly among young people. So One thing I want to say is you don't just do research and put it on the shelf. You really need to do something with it. There's no point for all of us to be working so hard on our research if it's not going to be used for really useful purposes. And specifically, from our perspective, we think the population level effects of policy is really important. I'm not at all denigrating program. We certainly work to help the program side too, but we tend to work much more on the overarching policy side, usually national level policy, because you're going to get way more population level effects, I think, with those types of interventions. We translate our research in all sorts of ways. Of course, we publish journal articles. We are at a big university here, so that's expected. And it is one way to reach a certain audience, but we do lots of other things. We publish briefs and fact sheets and reports and all of these other types of outputs that can help us reach other audiences. We do all sorts of strategic dissemination of those products. Has to be timely, it has to be appropriate to the audience. So you really have to think through, how are you going to disseminate this work? For example, we work on taxes, and taxes are very often renegotiated annually around budget time. So it's a really busy time, as you can imagine, for us, because we know that this is when governments are thinking about it and making decisions to change their tax programs. We aim to be a trusted resource. As Joanna said, we work a lot with governments to help them on their policies, so we work very hard to earn their trust, and we do so with our collaborative partners around the world, so that together we can be this trusted resource for them. We get very excited when they come to us for our help instead of us going to them and offering our help. And then we really think about this idea of sustainability. If our Economics for Health team disappears tomorrow, we want to make sure that there is a legacy of all of these people around the world who can pick up this work well after we're not here. So let me move to the actual health taxes. I think I know I have quite a varied audience here. Some of you are extremely familiar with this, some of you less so. So I'm just going to give a quick run through and make the justification for it. This is none other than Adam Smith. This is a favorite slide of mine. Those of you who know my close colleague, Frank Chalupka, he always loves this slide. Adam Smith, as many of you know from your early econ classes, he's widely considered to be certainly the grandparent of capitalism, maybe also the founding father, or one of the founding fathers of liberalism, from the late 17th, late 18th century, that period, John Locke and others. If this person is saying it's okay to tax these things, it's totally okay to tax these things. That's really how we look at it. There's no good use for any of these things. These are all things that are, first of all, luxury items. Second of all, cause what economists call negative externalities, right? They cause damage, and societies actually have to pick up the cost of these negative externalities. So, what is a health tax? Well, from our perspective, it's an excise tax or its equivalent that is applied specifically to a product or a category of products. And these products are generally ones that generate, as I said, these negative externalities. So things like tobacco, alcohol, sugar-sweetened beverages, other ultra-processed foods. You often see them on certain types of energy, especially ones that cause a lot of pollution. So really anything that you have to think about the fact that the government and therefore the society actually has to pick up the tab for the damage that these things cause. So that's just a general idea around excise tax. And it raises the price of these goods, but I want to be very clear. It raises relative prices. And this is a little bit different than, say, a value-added tax or a sales tax, which tends to raise the price of goods and or services altogether. And what we see with consumers is they actually react more to relative prices than they do to overall prices. And this is why an excise tax is a much more refined, targeted tool that is really useful from the perspective of getting people to consume less of these unhealthy products. It's a really simple mechanism. You raise the tax, the price goes up. I will say that most of the companies that sell these goods, I would say the vast majority of them are publicly traded. So they have a fiduciary responsibility to their shareholders to make a profit. Eventually, they might hold off for a while, but eventually they're going to raise their prices. And that's what we want, because when they raise their price, we know that most consumers are sensitive to price, some more than others. I'll talk about that. And then consumption is actually going to decline, which is exactly what we want. And that consumption declines in three ways. It declines through people quitting. That's ideal. We see that a lot with tobacco. It declines with cutting down, or it declines with not starting. And that's where, we're really interested in youth, because we know that youth are very price sensitive. So it is a really great strategy for getting used to either not use these products or to delay initiation. And what we've learned is when you delay initiation, that the overall patterns of their usage thereafter actually change and are better for public health. So we want to delay usage is one strategy. Of course, we would prefer if they didn't start. So what's the very broad overarching case for health taxes? And so they absolutely promote public health by reducing the consumption of these unhealthy products. This saves lives. We know that quitting these products makes ex-users healthier. We know that reducing consumption of people who continue to use these products also makes them healthier. Less so with tobacco, just because you don't get as many rewards. If you're a three cigarette a day smoker versus a 10 cigarette a day smoker, you're not getting that many more health rewards, if you will, from cutting down compared to some other unhealthy products. We know, through decades of research, that it reduces healthcare expenditures, both government and household level, and it promotes economic productivity, broadly speaking. We know that healthier workers are more productive, and so it actually begets economic growth more broadly. And then finally, because these goods, at least tobacco and alcohol for sure, are inelastic, we actually get tax increases, consumption declines, but we get revenue increases. And so this is really very exciting and frames many of the discussions I have with finance ministries all over the world, because quite frankly, they're most interested in the financial, fiscal, if you will, rewards. So how are we doing? How are we doing on health taxes? Not good. Tobacco taxes, I would say it's uneven across the world. And I'm using the very technical term of meh here. And for those of you coming from other countries, probably online, meh means not great, not terrible. We could be doing better. I like to think of it as a huge opportunity, rather than the negative part is we're not doing well. It's like, look at all of the potential we have to do so much better to use these health taxes to drive down consumption. Alcohol, also uneven, and generally not as good as we've done on tobacco. If you actually look at tax shares of alcohol tax as a percent of retail price, it's considerably lower than tobacco taxes as a general rule across the world. So we've got even farther to go on alcohol, but again, even larger opportunity in terms of saving lives. And then sugar-sweetened beverages, I would say, also uneven, but unfortunately bad from a public health perspective. What we see typically is a lot more use of SSBs simply to raise revenues, and not a lot of thought and care, unfortunately, given by governments to using it as a tool to drive down consumption for public health. So we've got a ways to go on that. But again, if we had this conversation 20 years ago, we're doing a lot better. So we are making progress. I want to reinforce that, but we have a ways to go. I want to take a slightly deeper dive into cigarette taxes, just to give you some idea of what's going on there, just because it's the area where we have made the most progress in the last decade or two. Our team actually publishes a report biannually called the Cigarette Tax Scorecard. We have the new one coming out in November. Please look out for that. We'll have another launch and webinar for that. But we have actually already crunched the numbers, and I'm going to give you folks a sneak peek today. So promise not to spread too widely here. As I said, every 2 years, we use the Global Tobacco Control Report from the World Health Organization mainly. They collect fabulous data. We're most grateful to them. I don't know how they do it. Looks painful, but we're grateful for it. It's really an amazing data source. And we use it to, and we mix it with macroeconomic indicators from our colleagues at World Bank and IMF and other places. But we look at the absolute price. We know that price is the thing that people react to, as I said before. We look at change in affordability, because it's not just price, it is price and income, right? Because as people's incomes go up, their disposable income goes up, and it affects their consumption behavior. So we have to really look at both. So we're really looking at more than just price, which is why we have this component for, did it become more affordable or less affordable? We look at tax share of price. I had mentioned that a moment ago. We look at both excise tax and total tax share of the retail price. And then we look at the overall structure. Structure matters. How countries actually structure their taxes really does make a difference. And we see good and bad tax structures around the world. And we use this tax scorecard to, give a grade and tell countries, hey, you're doing a great job or you're doing a lousy job. And these are the things that you need to do a great job. So we're very prescriptive, in fact, in the things that we do to share this with our colleagues in governments around the world. So here's my sneak peek. What we saw in so we used the 2024 data that was just released this year in the summertime, North American summertime, by the WHO, and we use these to calculate the new numbers. So they had collected 2024 data. So we're comparing 2024 to 2022, and we actually go all the way back to 2014. We actually have a really nice time series now of what's been happening with tobacco taxes over this 10+ year period. We're seeing that we're about even from overall from 2022. And this is disappointing. We were hoping that we would see more of an improvement. I will say that it's very uneven. And this year we actually had more countries improving than we've had in previous editions of the scorecard. I think our messages are getting through, I truly do. But as I'll talk about over the next 20 minutes, it's hard. It's not super easy to get this message through, and we're trying to come up with even more effective ways of getting our message to the appropriate stakeholders. What's the big what is the weakest link in this coming edition of the scorecard? It's the change in affordability. So even in places where we're seeing some tax increases, you have to account for both inflation and real income growth. Otherwise, those products actually still in actual terms become more affordable. So in this, I won't get into the esoteric discussion in economics, but it's about real purchasing power. And so what we're seeing is that in a lot of countries, these things are actually, even if prices are going up, they're becoming more affordable. This is very worrisome. Now, one opportunity that we are seeing is that we're seeing in a lot of countries that prices are going up. And that's not always directly related to taxation, to taxes going up. What we're actually seeing is that the tobacco companies themselves are raising their prices, which should be a great big green flag to governments around the world that they should be raising their taxes, because all that's happening is the industry is raising its prices, they're grabbing the profits, and governments are losing out on lost revenue and the public health benefits. So in my mind, how I interpret these data is, hey, you know what? You're missing this huge opportunity. Very clearly, the tobacco industry sees this as an opportunity and is actively and aggressively raising its prices in many, many countries. So that's my plea to them. You'll hear more from this over the next couple of months as we roll out the final edition. So I want to also mention, shameless plug again, we're going to be coming out with an alcohol tax scorecard. Maybe by the end of this year, probably more realistically by the beginning of 2026. We've been working with our colleagues in the Reset Alcohol Initiative on alcohol taxes around the world. And we wanted a way to, much like we do with cigarettes, be able to do this for alcohol. So we're going to have a scorecard that looks specifically at beer and wine, which is what, frankly, most countries are most consuming. So now my big question, how do we do better on health taxes? How do we make this case more compelling? And it's a big question, and I have some ideas, and I'm going to share them with you today. I think the really obvious one sometimes is we need to connect. We need to actually connect with the correct stakeholders and build trust with these stakeholders. I think this is a really important, maybe self-evident, but maybe not. I certainly see some of our counterparts not taking the time to build these relationships, and I think they're really important. And what I want to actually pull apart here is there are different types of stakeholders. And I will say that coming from an academic institution, working very much on the technical side, I tend to deal with one type of stakeholder, and those tend to be the technical people in government. Those people typically are not decision makers. They might inform decision makers, but they are not ultimately the people that are making the decisions. Those are the political actors, and they're usually elected officials. As I point out here, we have some folks that straddle those two worlds, right? Ministers, deputy ministers. These are political appointees. They are both technical and political, quite frankly, but they are usually serving at the whim of the elected officials, so probably more political than they are technical. So we have a lot of great discussions with our technical counterparts. And I would say that we've worked really, really hard to grow these relationships over the years. And we work with our colleagues in international governmental organizations like OECD, World Health Organization, IMF, the World Bank. We're all working together to have really meaningful discussions with these stakeholders. They're important. I think they're a necessary condition for good policy change. They are most certainly not a sufficient condition. So I think we're doing really well there. I think where we're doing less well is with the political actors. This is where we have less success in terms, if you will, winning them over. And I want to, contemplate for a few minutes why I think that is. I do think we can continue to do what we do better. Some of the things that we've been doing is, as I said, we want to build as much domestic capacity in these relationships as possible. It's one thing. I live here in the United States. It's not easy to just hop in a taxi and go to the Ministry of Finance in Vietnam, right? So I need to have my colleagues on the ground who can do that, and that's really important. So I think we're doing a much better job on that. We needed a really convincing body of evidence. Again, I think on tobacco taxes, we're really doing an amazing job. I certainly invite you to go and look on our website, economicsforhealth.org. If you type in any of those topics that I had up before, you're going to pull up a range of studies from across the world. I think the amount of high quality research that we've built on tobacco taxes over the last 15, 20 years is extraordinary. And the case is unequivocal in my mind from a intellectual rigor perspective. But again, as I said, that's only part of the battle, and the political battle is one that we have work to do. Here, I asked the question, what is it that elected officials want? And I'm going to steal shamelessly from my close colleague and friend, Carlos Guerrero. He's on our team. He works in Mexico City, among many other places. But we've talked a lot on our team about how do we get our messages to the right people, or how do we work through our partners to get the messages to the right people? We may not be the ones always talking to political actors, which is why we like to work in these type of consortia where we're working with civil society, other academic institutions, IGOs, et cetera, because everybody has different connections to different stakeholders. And mine, as I said, are not necessarily very often to the elected officials, sometimes, but very much from a technical perspective. I'm not at all an overtly political operator here. But we asked ourselves the question, what do they want? And Carlos came up with money, power, prestige, image. All seem pretty reasonable to me. I think he's probably spot on. So the question is, what do we have to offer them? Do we have power to offer them? Probably not. Is health tax an avenue to more power? Certainly not directly, maybe indirectly. I'll talk about that in a second. Do we have money? And I think that answer is yes and no. I think on a broad level, as in more money to the government, the answer is yes, right? It generates more revenue. The more you raise your taxes, the more revenue you're going to generate. So this is real money. And in some countries, it's quite a lot of money. In some countries, it's not. And I'll be very, very candid about that, right? That you won't necessarily be able to sell the revenue argument simply because, very large, sophisticated economies have many revenue streams. Smaller, less sophisticated economies have far fewer revenue streams, and so it might be a more compelling argument. So money, yes. Obviously, we're not giving money to individuals, but we know that there are legal avenues through which money is given to individuals especially in the form of campaign contributions, if they're permitted legally in a country. We see lots of ways that money actually transfers hands to, specific political actors or the ecosystem around those individual actors. But going back to the broad, I think that money was a big sell. In 2012, the Philippines had what's widely regarded as the most successful and most impactful reform of a tobacco excise tax. And one of the big sells was that the money was going to go to improve universal health care for those in the 2 lowest quintiles, so the bottom 40% of income in the country. Thought it was a brilliant strategy. People loved it, and it had a lot of public support. So in that case, money talked, but it talked in a very different way, in a very good way, actually, that was really good for people in the Philippines and, broadly speaking, for health and for economic growth in the Philippines beyond that. We think there's also a big prestige and image issue here, and that we do think we have a lot to offer certain types of politicians in these circumstances. It's not everybody. Some politicians don't care about, I guess, this aspect of their image, but I think many do. And we think it's because we sell truth, right? We sell truth. It sounds trite, and I don't mean to be trite, but right, the work that we do as academics is we do work that is transparent, can be replicated. This is as close to truth as you're going to get. Things might shift over time as the science gets better, but that's different. And I think there are many, many politicians who do still like to sell truth. And I find that when we find a champion in government, it typically is those types of politicians. And I'm going to steal a phrase that Martin Luther King Jr. liked to use. He always said, the arc of the moral universe is long, but it bends towards justice. And I like to think that the arc of policymaking is long, but it bends toward truth. Maybe that's completely Pollyanna-ish of me, but in our experience, we really do see that we work with people who want to do the right thing. And I guess I have to believe that, or I wouldn't come to work every day. What about the flip side, shame? I'm less sold on shame, I've got to be honest. And I know it has worked. And it works, I think, in very specific circumstances. In our experience with taxes, it doesn't work very often. And I think it is mainly because of several things. One, it's somewhat esoteric, so people don't really understand it. So shaming people is really tough, because what do you say? You're like, we did our simulation model, and as it turns out, the consumption isn't as large as it could be for, it's a really hard message to make. And I also think that if you will, the anti-tax propaganda that is out there is really effective, and we have a tough time working against it. So I'm not sold on the shame, and I'm much more sold on the more positive aspect of truth. So, question: why is it that the policymakers don't trust us? Why aren't they listening? And a lot do, and many don't. And we want to try to understand, how do we reach those folks better than we are? I think, first of all, there are some good reasons that they're not listening. Those of you who work in policy making or have worked in policy making, it's hard. Let's not kid ourselves. Making policy is really, really very difficult, and there are a lot of competing priorities. So I don't pretend that it is easy to make policy. So I am actually quite sympathetic to this idea. And sometimes there are really big problems to deal with. Right now, we're dealing with, in a lot of countries, very specific to taxation, a lot of these countries are dealing with tariff issues around United States policy. And they can't think about this because they have other things they need to think about. And we have to figure out, where do we fit in this discussion? I will say that our colleagues are overwhelmed by competing messages, many of which are nefarious, but still, unfortunately, pretty well orchestrated, very well resourced, and very often pretty compelling. And imagine that these folks, as I just said, are really busy because they have a lot of things. And so you get these things coming at you, and you make shortcuts intellectually, and unfortunately, they make the wrong shortcuts a lot of the time. We've learned that policymakers' mandates are very narrow. So when we're dealing with finance ministries, they don't have a health mandate. So when you're making a health argument, they often will look at us and say, very interesting. Anyway, what about the revenue? So this has to be our reality when we think about it. And then we've also learned that career technocrats are risk averse. They want to keep their jobs. And these are really touchy issues. When you're dealing with tobacco industry, alcohol industry, sugar sweetened beverage industry, these are powerful, powerful political entities. And people don't want to go out on a limb for these a lot of the time. So we have to also contend with that and be realistic about it. There's some terrible reasons why policymakers aren't listening, and I think we should talk about those. Sometimes our messaging isn't as effective as it needs to be. That's on us. We've got to keep working on that. Sometimes policymakers are lazy. That's annoying. I don't know what to do about that. It's real, and we absolutely see it sometimes. It's not that they're so busy, it's that they're just lazy, and that's just maybe human nature. As I said before, we see decision makers are affected by legal ways to influence policy. There are legal ways to influence policy. It's how democracies typically work. I call this the false equivalency problem. Very often, I walk into a finance ministry and they'll say, yes, that's very important. Yes, great, great, great. Very important, thank you, Jeff. And then they'll say, and then the tobacco industry is coming in after you and they're gonna tell us about how important they are to us. And to me, that's a bit of a false equivalency because I'm giving a very full picture, including even the tobacco industry's contribution to the economy. I don't think they're giving the same full picture. And that upsets me when those two things are treated the same. And then the last graph, corruption. It's real. I see it. Absolutely see it on a nearly daily basis. And I don't know how to deal with that. If you have any ideas, I'm all ears. So what do we have? We have a narrative. And I think we need to think about our narrative. And it's really important. And some of you have heard me speak on this issue before. I think we're missing the boat a little bit on our narrative. And I think we need to do a better job. And I have some suggestions. And I'm happy for pushback on these. So our current narrative is this one. And it's relatively simple. Health taxes save lives and money, and they generate new tax revenues. I like this one. It's simple. It's a little bit multifaceted, but not too much. So it covers a couple of big things, health and fiscal, and that's awesome. And I think that's really important. And I do think we are able to reach some stakeholders with just this simple overarching argument. I do not think it is enough, okay? And I will tell you that the tobacco, alcohol, and sugar sweetened beverage industries have their own wild narratives, all right? And I think they do a far better job than we do. And worse than that, for us, is they tend to control the narrative. So there may be a discussion on a health tax, coming out, and inevitably the first op-ed I see is by one of those industries, not by us. We're getting that all wrong. We should be, the first shot across the bow should be from us. And I think we need to do a better job on that. I think we're getting better, and I think we're realizing this, but I think we have a ways to go on this, I do believe. So what are some of the refined, I'll call them sub-narratives, if you will. And I really, really think that we don't want to play defense, we want to play offense, and we want to have positive narratives. I think people hate negative narratives. I don't think they're compelling. I think people are much more interested in positive narratives. So that's really how we really try to approach things when we're, if you will, selling our health tax narrative to our stakeholder counterparts. Health taxes work. We absolutely know from decades of research that consumers are sensitive to price. When prices go up, people consume less. That's just a fact. Like, it's really a simple fact. And there are these sub-narratives in there that I think are really, really intriguing and important. We know that people quit smoking, especially smoking. They don't quit drinking as much. They cut down, but they actually quit smoking, or they don't start. This is huge. This is a massive narrative, and one that's so obvious. And what we've been getting a lot of traction with in countries in which we work is youth initiation. When we go that angle, we get a lot more political traction, because nobody looks at their 12-year-old and says, "Sure wish they would start smoking." Like, people don't do that. So that's where we have to get this, and we have to get that to be, the thinking. Health taxes work for drinking. As I said, overall, they drive down consumption, but we see that they work with heavy drinking. So this is people that drink a lot, and heavy episodic drinking, and that is, people who drink, on occasion, but really heavily. So yes, are people less sensitive to price with heavy drinking and heavy episodic drinking? No, but are they sensitive to price? Yes. Do these things work? Absolutely. Why wouldn't we do something that works? And we have plenty of evidence to support this. And as I said, these things work even better with young people, and typically people in lower socioeconomic groups are more price sensitive, which means overall, you know, these policies are really good for being progressive. And I'll get to that in one moment because I think it's its own special argument. We need to keep plugging health taxes raise revenues, new revenues, not just raise revenues, but raise new revenues. When you raise taxes, you get more taxes than you had before from this same product category, right? And it, again, can be quite substantial. There's a discussion on board right now. There was just a proposal made in Mexico to increase sugar-sweetened beverage taxes and cigarette taxes. We're talking about tens of billions of pesos that the government really needs right now. And so right away, you're just like, this is a no-brainer. If you need money, raise your health taxes. It's really good. And you know, you will hear the opposite argument. It's like, oh, you know, you shouldn't raise these taxes. They don't raise revenues. In fact, you'll lose revenues. And if that is happening, there's another explanation for it, which I'm happy to talk about in Q&A. But it is important that we reinforce that this is a huge revenue generator. As I said, health taxes are overwhelmingly progressive. We know that those in lower socioeconomic groups are typically most affected by the use of these products, disproportionately so, hugely so. So even if they just quit at the regular rate as everybody else, it's actually progressive in terms of disproportionate amount of benefit going to this group. But as it turns out, certainly in the case of tobacco, there's some evidence that's the same in alcohol as well, that those in those groups are more sensitive to price, which means they quit more and they quit to a greater magnitude. So they really win. And when you look at, and we've actually done this empirically, is you look at where the benefits of the tax go, and they go over more overwhelmingly to those in those lower socioeconomic groups. So they're wildly progressive on a population level. Sure, you'll have the individuals who aren't able to quit, and there are some issues with that. My answer to that is reallocate some of your new tax revenues to making sure those people are helped to cut down or to quit the unhealthy products they're consuming. Health taxes are good for the economy in lots of ways. Healthy people, as I said, are more productive. Economic growth goes up. Those two things are intrinsically linked, but also you know, distinctly enough separate that we should talk about them, both of them. And then what we see typically is employment goes up. These are actually capital-intensive industries for the most part. I don't know if anyone's ever been to a bottling plant for beer or Coca-Cola. Unbelievably highly automated, like 6 people working in a massive, massive factory. We're not talking about lots of jobs here, folks. And really, when we see people reallocating their income from the consumption of unhealthy products, they tend to reallocate to places like health and education, which turn out to be highly labor intensive. So you actually create jobs. We did a great study in Pakistan 3 or 4 years ago. We're talking about hundreds of thousands of jobs in a country like Pakistan when you have a significant raise of tobacco taxes. So it's quite extraordinary. I want to talk about, we are subsidizing these industries, right? There are massive, massive problems in terms of having to subsidize these industries because we pay the costs as society. And I don't think we talk about this enough, and that is problematic. The last point I want to make is about health taxes getting caught in broader narratives on tax. Nobody likes tax, and this is a real problem, and I think a complete shortcoming on the part of governments worldwide. Tax has been demonized, and this is a problem. I think we need to really communicate better with how do we reach people and tell them, hey, taxes do really great things. Look at your roads and your schools and your hospitals. You can't do these things unless you tax. And I think we do a very poor job in making those connections. I'm going to skip a few slides here and just go to conclusions in the interests of time. What do? As I said, we should own the narrative. Don't give it to these industries. They're happy to own the narrative. Tailor your narrative to your audience. Marshal the evidence. We have a lot of it. We are doing, I think, a good job. I think we could do an even better job. Be bold in what you ask for, but don't be ridiculous. You need to be taken seriously. So I think there is a fine line. You need to calibrate that with your in-country partners. Build strong partnerships, as I said, across stakeholders, and use your consortium of different types of proponents of health taxes. Build trust, and sadly, persevere, be persistent. This is a long-term endeavor. We're not gonna resolve this tomorrow or next year, but I think, as I said, that arc is going towards truth. So that's where we're headed. So thank you.
That's fantastic. Jeff, thanks so much. We have time for a few questions. I'm gonna start with one online, which I think is a really important one to just get on the table. So the question is, can you tell us about the correlation between higher taxation, health taxes, and the prevalence of illicit trade?
Sure. Yeah, I think that's a great question, and one we get asked every day. And so here's my answer. I would say that they're not strongly correlated. Is there a relationship? Yes. In some circumstances, under specific conditions, yes. When we actually look at what most predicts levels of illicit trade, it's usually governance. That's the biggest variable. If countries have the measures in place to address illicit trade. We have a protocol to eliminate illicit trade in tobacco products, for example, but you can take those same measures and apply them, for example, to alcohol in many ways. When we see countries that have those measures and enforce them well, we really see that it mitigates illicit trade. This isn't to say that it isn't something we should be worried about. We absolutely need to address it, but we have tools to do it. I will say that in countries where we do have seen increases after a tax increase, I've never really seen an instance where it undermined the overall positive public health and fiscal nature of the tax increase. So even though we might lose a little, the gain was so large, it far outstrips any loss from the slight increase in illicit trade.
I had a question around youth trends, and I know that youth are veering away from alcohol consumption as well as traditional cigarettes, but the move towards e-cigarettes, given that it's generally an unregulated industry, how does that fit into the current taxation frameworks?
Yeah, it's a fabulous question. We're still feeling our way through this one, to be perfectly honest. They're a more difficult category of product to tax because they're quite heterogeneous. There's no like one e-cigarette. If we look at cigarettes, they're pretty much all the same all over the world. If we look at alcohol, the main ingredient we're worried about is ethanol, and typically we recommend taxing by the amount of ethanol in whatever, if it's wine, beer, spirits, doesn't matter, it's still ethanol, right? It's still causing the same type of harm. E-cigarettes and other similar newer tobacco products are a little more difficult. That said, there's absolutely no reason they can't be taxed and taxed effectively. And what we're doing, honestly, is trying to integrate them into existing tax regimes for tobacco products, such that we're making sure that they're taxed at a level that is similar to cigarettes. That's not always easy to do, but that is typically the general goal that we counsel. Tax them in an equivalent way to cigarettes, mainly so that we're not getting young people initiating with these products because they're cheaper, right? So we know that they do act as substitutes in many circumstances for individuals, not all, but some circumstances at least. So it's a precautionary principle, right? It's just, we don't know as much about these products, but we do absolutely know unequivocally that they're harmful, very harmful to young people. We don't want them starting. So we really do need to be thinking about how to tax them effectively and making sure young people aren't starting to use them. We're getting much better at it.
We'll go quickly online and then back to the room. So slightly more technical question, but as tobacco has been considered in inflation calculations as a product, so when you raise tobacco taxes, inflation increases as well. So how do you address this issue?
Great, that's a very good and technical question. Here's my short answer. I actually will teach a whole seminar on this. first of all, we strongly encourage companies to drop tobacco and alcohol from their basket of goods to calculate inflation. We think they are very distinct goods that should not be, none of these are necessities. People do not need to buy tobacco and alcohol. Nevertheless, some ministries of finance insist, or statistical agencies insist on including them. In those circumstances, we do the calculations and we show them what type of an effect it will have. Generally, the effect is quite small in most countries. So you can have a very sizable increase on beer and wine or whatever, or tobacco, and it will have a very modest increase on inflation. It's measurable and we'll measure it, but it's not any reason, I think, to dissuade governments from actually raising their taxes.
I was curious if you could talk, you talked a little bit about like national organizations like World Bank, but how do ministries of finance or just stakeholders at the government, how do they talk to each other? Do they talk to each other at all about their experiences with like different policies and how to pass them, their effects, like, or is it every country kind of thinks they're unique and they need their own sort of prescription for health taxes?
It's a great question, Lauren. The short answer is most of them are just thinking about their own country. There aren't a lot of fora where they're discussing this issue. Unfortunately, it's getting a bit better. I know I'm presenting at a tax policy forum in the ASEAN countries in Asia in November about excise tax. And this is a bunch of ministries of finance getting together to talk about it, which is really exciting. We've also undertaken, we co-hosted an event last year, actually at the Hopkins campus in DC, where we worked with Pan American Health Organization, OECD, World Bank, and we brought together ministries of finance from all over Latin America to talk about excise taxes. And I don't think they had really talked to each other much about them. And let me tell you, we couldn't get them to stop talking. They absolutely loved it. And the feedback we had from them was, wow, thanks for getting us together. We never would have done this. Plus, if you've ever been to that campus, it's a beautiful view of the Capitol. They like that as well. But it really was extraordinary at how much they wanted to talk to each other and share experiences. And we're really having some very, very serious discussions in Latin America right now. And I'm not going to point to that as attribution, but I think all of these types of things really help to generate the type of dynamic discussion that I think is important. I mean, we have wildly important discussions going on right now in Mexico, in Brazil, in Costa Rica, in Colombia, all of these, Peru, so many countries that were there. And I know they're still talking to each other, and that's pretty cool.
Okay, we'll jump online again. And there's so many great questions online. I don't think we'll be able to get to them, but maybe I can send them to you afterwards and you can respond. But I'm paraphrasing one of our participants, but they say, you know, the case for health taxes is crystal clear, and you've presented that. It's crystal clear, and we've been working, public health, academia, have been working so hard on this for a while. Why is it so hard to get health taxes?
I really think it's partly a narrative issue. I think we have not owned and promoted the positive narratives nearly as well as we need to. I am still struck in so many countries where we work. So we have some partners that monitor media in the countries in which we work. And I peruse the media bulletins I get every day or every week whenever they come in. And the overwhelming messages are the ones coming from the industry still, and not from us. And I don't know whether it's just because they have all the resources to drown us out. That's possible, that's part of the problem. I'd like to think that we could do a better job getting our messages out, and that people will actually listen, because I think they have no evidence to support their claims. and we have mounds and mounds of it. But I think it's partly a shortcoming on our own part in terms of our public relations. I think we need to do a better job. I truly do.
I'm gonna venture in a political economy question. Do you think that tax and successful tax help to win elections? Because you have the power. I tend to believe yes, but I don't have the informal correlation study.
Yeah.
But maybe an historical study will suggest that mayors or ministries or Ministry of Finance who are venturing to doing this, they got a lot of political capital to run and win later.
Yeah.
So maybe we need to make that connection. But again, it's not my area, but maybe the connection is there.
Thank you. It's a great question, and certainly one we think about. To be honest, we typically find that the biggest tax increases we see are usually early in an administration, not late in an administration before an election. Taxes are a hard thing to message around. I mean, I think that when we think about the Philippines tax in 2012, I think that the legacy of that is a very positive one, but then presidents are term limited in the Philippines, so there was no re-election there anyway, and there couldn't be. There's never been a study on this, and it's partly because it's really hard. So many variables are going to predict whether or not somebody gets reelected or elected. So that's a tough one. The relationship between elections and tax reform is a really tough one. I'm not sure I would go there. I would be skeptical, mainly just because of all the misinformation and, frankly, bad reputation around taxes, more broadly speaking. I think it would be a little, not a little, be a lot risky, I think, for people to bank on that as an electoral strategy. And that is based on no empirical research either.
I want to thank all of you who came in person and all the 100+ people online who joined in. And thank Dr. Jeffrey Drope for an amazing sort of health taxes 101 with a lot of insights of like how this really works on the ground. So thank you so much.